Palliative care services and hospice services are actually often provided by the same group of people. And so once a man has progressed on palliative services such that he is no longer able to take treatments for his prostate cancer, even those oral treatments, he can transition pretty seamlessly to hospice services with the same group.
I think that all the evidence suggests the sooner you bring up these topics, the better these transitions are, because there's a lot that can be put into place around end of life. You want someone to feel comfortable.
Just sat down with us and said, well, we can't do any more for you, so I think you need to get some palliative care, hospice. And the next day when we got back to our cottage, I called a hospice. They were wonderful.
Ultimately, palliative services are really focused on improving quality of life, reducing pain, increasing appetite, making day-to-day life easier and better, but allow you to be on active prostate cancer treatments while you're receiving them. Whereas hospice attempts to do all of those things as well, also provides support for caregivers and family members who are going through the process with the patient. But at that point, patients are no longer able to be on active medications against their prostate cancer.
Palliative care actually can be quite good at getting them to feel better. So I think sort of removing the stigma attached to these terms. I think hospice is even more pronounced as far as people's connotations of you're throwing in the towel. This is something that's very negative. But I think if you've had sort of effective discussion prior to that about, we're transitioning to managing symptoms, it's about quality of life. Sometimes just because we can do something doesn't mean we should, because the side effects you're going to have are just too great. And doing something like hospice where we can make you comfortable is more important than trying to give you a therapy that's probably marginally beneficial and going to make you feel terrible.
He was at home, and we set up our downstairs living room. Took one couch out and put a hospital bed. He had the television if he needed it, wanted to watch it. It was near the kitchen. People could come and visit. It worked out really well that way. My stepson, my daughter, and our dog and myself slept in the room that night with him, and our dog was right beside him on an ottoman, just level with him, and it was really cute. I wish I could have videotaped it, really. It was cute, because he was really alert, and he was telling us that he loved us and things like that. It was really nice, but he also knew that something was happening that couldn't be stopped. I really know he knew that. And he still thought he was going to beat it. I think he thought he was going to beat it till 2 weeks before he died. He really did. He was tough. He'd never been sick in his life.
And I think if you've got a long relationship with the patient, you've walked with them through a lot of their journey, they're willing to sort of trust you and say, Doc, I know we've been together, we've done everything we can. I think you're right. We need to start looking at this as the best thing for me. And it's, again, another decision where with the family, you've really got to be on board all together that's what you want to do and the direction everyone wants to go.
I don't think a family, a husband and wife and a family could really get along without them, truly, unless you had some private nurse or something. I think hospice is the answer for sure. I don't see how anybody could do it without them. They know what to do. They're fabulous. That's what I tell them, have hospice and do what you can too.